Nitty-gritty. So now that everyone is fully informed as to what my health record is, this is a little session on registering made simple. So we're just going to be running through some of the steps in the hopefully the correct order that make it easier for you to understand who your registration support team is and where to find all the resources that you need in order to register and to provide education and training to your staff. Okay, so they were a little bit text heavy on some of them, but I will try and get through it the best of my ability without being too tedious. So, right, so let's assume that your organization is planning on registering for My Health Record. So if you're contemplating that, you need to identify who within your organization is going to take on the role of a responsible officer. You will see the abbreviation floating around of RO. RO means responsible officer. This is more often than not the highest person in the food chain. So the CEO level would normally be the person who would make the decision for the organization to implement My Health Record into the clinical information software system. So the RO will then have the primary responsibility for ensuring the provider's compliance with participating with My Health Record, ensuring that all of the employees comply with the relevant legislation or the policies and the regulations. The RO can nominate and delegate another person within the organisation to support them by naming them as what they call an organisational maintenance officer or an OMO. So you can see a reference at the top of this slide to the HI service. The HI service is the Health Identifier Service. It is a national service for uniquely identifying healthcare providers, healthcare organisations and individuals receiving healthcare. So it is the authoritative source of healthcare identifiers in Australia and a foundation component of the National Digital Health Products and Services. So the three main identifiers that we talk about in My Health Record land and in the HI service are HIPO, HIP-I, and HIP-E. We're going to go through those in just one moment. So upon registering for My Health Record, your organisation will be issued with an identifier. This is called a Health Provider Identifier for your organisation, HPIO. So in conjunction with that, each and every clinician within your organisation and relevant non-clinical staff that have permission to access the record will also be provided with a health provider identifier, which then must be subsequently linked to the organisation. So for clinicians, this is not your APRA number. So some people think that your HIPI is your APRA number. It's actually the ID that you use to log into your APRA, and then it has a numeric sequence at the beginning of it. If you need any further information around that, don't hesitate to reach out. Now, let's say, for example, I know I said that some relevant staff will also have a health provider identifier. So you may have some non-clinical people, but I just want to flag the point of difference is, say, for example, your cleaning staff will not be provided with a health provider identifier because they have no need to access the clinical records. But you may have an admin person who is non-clinical that will be provided with an identifier so that they can access the record for admin purposes. You also then have an individual health identifier. So each resident also has to be appointed an identifier called an IHI. It's not dissimilar to what you'd find on a Medicare card. So step 2, registering for a professional online digital access account. So the responsible officer, so the top of the food chain, the CEO, the most senior person, whoever that is, must register for a PRODA account. So most clinicians will have them these days, but some do not. So PRODA, again, stands for Professional Online Digital Access. Now, this is an account which is unique to you as an individual clinician and needs to be linked to an organisation. So this is yours and yours to keep wherever you go. So if you leave an organisation, your proto identifier goes with you. And it will need to be unlinked from your organization and relinked at the new organization. So once your proto account has been created, you will be issued with a registration authority number, and you'll be sent that via email. So the RA number is unique to your account, and you may need to give this to your employer after your account is finalized. You can see here in this slide that you do need some identification in order to complete that proto registration. So make sure you've got those pieces of documentation. So driver's license, passport, or bank card or something that identifies who you are. So we're still on step 2, linking your proto account to your HPOS account. Your HPOS is your health provider online services. So why would an aged care provider use HPOS? So aged care providers may utilize HPOS for various reasons. So it could be accessing patient information, managing any claims, managing delegations. So HPOS facilitates secure online interactions with Services Australia, allowing providers to access numerous services, programs, and payments. So you need to find your existing aged care service within HPOS. You need to access your health provider services as an individual through Proda. So get your Proda account, and then through Proda, once it's been created, you can link to HPOS. So linking will depend on what information your service requires to establish your eligibility to access the service. In this case, it should be your HPII. So to link your individual Proda account, so you would go to select services. So you can see here on the screen, you've got your Proda in the black banner, and in the top right-hand side, you've got services. And then select the relevant tile from the My Link Services page. So when you click on the My Link Services page, see down on the left-hand side, you've got My Link Services. If the tile is not there for your organization, because your aged care provider should essentially already have their service listed on there, because they will be already using HPOS. So they just need to find your relevant organization, and then follow the prompts once you've clicked on it, and it will actually step you through and tell you exactly what you need to respond to, and it will take you exactly where you need to go. But linking your identifier as an individual to your organization is the most important thing there. So if your service tile is not visible to you, it may be your brand new organization and you've not yet registered your organization on Proda, and it's not visible within HPOS, or you don't have the right authority or the right permission. So it might be there, but because you're coming in at a level lower than the RO, you may not have visibility of it until you're allocated that permission. So you'll need to seek authority from your RO if you're going to be labelled as an OMO to help support the RO with all those delegations and all the back-end admin stuff. Now, if you're going to go back and link your organization, there are some simple steps to follow. So you would just need to log into Proda, just like you did previously. Select organizations, which is at the top right-hand side of the screen, as you can see there. Select register new organization, which you can see at the bottom there of the page. You need to have the following details to hand, though: the name of your organization, the proper business name. You need to have the ABN and any organization contact email addresses you will need to have handy. So as the RO, your individual Proda account name must match the associate or the authorised contact name for the organisation on the Australian Business Register. If they don't match, you'll hit a brick wall and ask you to go back and make sure that the correct information is put in place. And please don't hesitate to reach out if you need any further information around these steps. Another reason why your tile might not be there is because your organisation, it may be there, but you don't have visibility due to permissions, as I mentioned previously. Apologies. So we're still on step 2. Moving into step 3. So establishing a security and access policy. So prior to registering to participate in using My Health Record, your organisation will need to develop a security and access policy. you will be required to attest at the time of registering with My Health Record that the policy is in place. A policy template has been provided for your convenience. If you can't find one of those, please do not hesitate to reach out and we can provide you with one. Now, within that policy, there are actually 12 obligations which must be adhered to. And I'm just going to sing out a couple of those to you now. So one of the obligations is you have to have a process by which you manage any emergency access. And this should be part of the privacy and access section. Another component that you'll need to comply with, ensure that you have that the details for the organisation's RO and the OMO are kept up to date in PRODA. Say, for example, one of those individuals may leave the organisation. You'll need to make sure that as they exit, that someone is responsible for unlinking them, and as a new person comes in, making sure that those linkages are there, because they're responsible for every other staff member being linked as well. Another obligation is to have a process to manage any data breaches. And this process is going to outline exactly what the steps are to notify of a data breach. We do also have a policy checklist to guide you through all the essential information that must be considered when you're putting together your policy. And the policy must also disclose how your service will undertake any relevant training for any user of the system before the system actually goes live. So it must have things like how to use the system correctly and responsibly, understanding what the legal obligations are, not just for the organisation, but for the staff as well that are using it, and what are the consequences of breaches. Steps 4 and 5 combined. So consider your organisational structure. So it will be set up as either a seed or a network. So you'll see from our example here, is showing a medical practice. However, it could be the same kind of thing for aged cares. So it depends on whether you're corporate or whether you're an independent site as to whether you're going to be set up as a seed. So if you are a corporate aged care provider with a multitude of sites that sit under your head office may be set up as a seed. However, the remaining sites may be part of a network. So all sites within your network will need to be linked to your seed organisation. So the decision on how you set up your organisation will be up to the most senior person within the organisation, because they will know exactly what will suit them best. So you have to identify all AHPRA registered and non-AHPRA health identifiers working for each site. So all of the staff, they're going to be using essentially currently use your clinical information software system will need to be linked into My Health Record. So, and each one of those staff will have a health provider identifier, and that's what they need to link. So step 6, so have you got conformance software to start with? So we need to check that out. So that we do have a register for those who are unsure, which goes through the whole list of who's conformant and who's not conformant. So if you're not on the list, you can talk to your software provider and say, listen, when are you becoming conformant? If otherwise, you can use the National Provider Portal, again, which is equally as beneficial. You just don't have a bespoke piece of curated information to upload, you can only view. So this is a little example of the National Provider Portal I was just mentioning about. So the National Provider Portal is web-based, it's read-only, lets healthcare providers view the information in a patient's record. As I mentioned, you cannot upload any documentation. To use the National Provider Portal, healthcare providers will need a healthcare provider identifier, so that's the HIP here, before you get set up. So your organisation will need a healthcare provider identifier, and be registered to participate in My Health Record. So you still need to go through the registration process, even though you're not going to be using conformance software, because we can identify in the back end who's utilising it through your registration. So we've come to the end of registering made simpler. Please do not hesitate to reach out with any questions or queries. You can see here an email address, mhr.registration.rac@digitalhealth.gov.au, who is the Australian Digital Health Agency, there to support you. Of course, you can always reach out to me. And we do have some further resources just on the next page, which are specific to aged care. There's a lot of e-learning modules. There's that software register there that I mentioned. There's that policy template. And there is a resource list for all of the steps that you need to go through in order to register for My Health Record.